A lot of times athletes have problems reaching overhead to full extension, and they often blame the shoulder joint only. On this back and body video, we're going to talk about another area you might be neglecting. Hi, Dr. Dave Perna here with Back and Body, your collaborative care approach of chiropractic, physical therapy, and acupuncture medical care, offering our services in Midtown Manhattan, New York City, on 58th and Lexington, as well as on US Route 22 East in Springfield, New Jersey, offering our services to people of Union County, including Milburn, Summit, Springfield, Garwood, Westfield, and Cranford. Today, we're going to talk about overhead and the inability to reach overhead. We see a lot of athletes in our office who often complain about the inability to reach full extension and overhead. And if you're examining someone, typically you want to be able to see their bicep touch their ear. Now, I can't really show you that today because the shirt and jacket just don't allow that, but warmed up and wearing a t-shirt, that would be ideal, or as close to it as possible. With weightlifting and overhead lifting and even just activity, you want to be able to see the hand reach overhead and be able to get the lockout position. A lot of people can't achieve that, and they automatically assume it's always the glenohumeral joint, that's the ball and socket joint of shoulder. What area they often forget about is the scapula. The scapula rotates outward as the upper arm or the right arm were to reach overhead. So as that scapula rotates outward, you often have to look at what muscles are attached that don't allow proper outward rotation. Before we go any further though, I'm going to show you a picture that helps you understand that outward rotation. Just that. And it discusses glenohumeral scapular rotation. And you can see that from 30 to 90 degrees, which is your most important portion of shoulder movement, and that's taking the arm away from the body, there's a 2-to-1 ratio of movement. So as you see that right scapular wing out, there are muscles that insert that might prevent that. So let's talk about those muscles in detail. Okay, this is from Netter, pretty much a standard in looking at anatomy. This is the right scapula, and we're looking at it from behind. So we're going to look at that bottom tip of the scapula, and we're going to ask ourselves what muscle attaches to that would prevent or inhibit the swinging outward of the scapula. Well, that's latissimus dorsi. So latissimus dorsi may be stuck, or it might be hyperactive and not allow full relaxation of muscle that would allow outside swinging of the tip of the scapula that would allow this to tip upward. So it would swing like that. The other muscle that may be a factor is portions of the rhomboid, which actually pull the shoulder blade in. If they can't relax, it might not allow the scapula to swing out as well. Okay, so hopefully that information was helpful in making you understand some things you may need to do to achieve reaching overhead. Now, it's not to say every problem is related to lats and rhomboids. You certainly want to make sure there's no pathology or injury to the glenohumeral joint, that's the ball and socket joint. But if those feel okay and there's no pain or discomfort reaching overhead and you just can't seem to get fully overhead with your lifting or motion or reaching overhead to do things, you may want to look at getting some work done for the soft tissue work to the lats and the rhomboids. For more information like this, you can see our website, backandbodyny.com or backandbodynj.com. Click on the link for blogs. We'll see you soon.